Once someone is identified as having a chronic liver disease, they're often referred to our clinic. The general process for evaluating for transplant includes evaluating your heart and making sure that it is healthy enough to go through this big operation. Most people get an ultrasound of their heart, a stress test for their heart, and also see our cardiologist. We also do pulmonary function tests that look at the function of the lungs. Our patients also meet our social worker, and they evaluate the patient's family support because that's critical to a good result after liver transplant. They also look into making sure that the patient has insurance coverage to be able to get medications after transplant, because they will be on medications to prevent rejection for the rest of their life. They also meet one of our dietitians who optimize their diet. Some of our patients are also evaluated by a psychiatrist to make sure that any substance abuse problems they may have are treated and addressed. They're also evaluated by our transplant surgeons who make sure that they can carry out the surgery for transplant without any major technical problems. Once all this evaluation is complete, our patients are presented at a transplant committee meeting. If there's an agreement on a person being a good candidate, we can then place them on the transplant list. What I tell patients is that our results after transplant are really good because we really select who gets a transplant. So if we find out someone has advanced heart disease or has bad lung disease, or doesn't have enough family support to be able to bring them to clinic or take them for blood tests or make sure they're taking their medicines right, then a transplant's not the right procedure for them to go through. And because there's such a shortage of available livers, we want to put those livers to the best use and get the best results with transplant.